Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Irene Santos, who runs the Health Promotion Program at Umbrella Multicultural Health Co-Op, a community health centre in New Westminster, BC. Umbrella Multicultural Health Co-Op is a member-driven, culturally connected cooperative healthcare centre providing equitable care for people who have language and cultural barriers. How are you today, Irene?
Very good, thank you.
Wonderful. Just wondering if you could briefly tell us a little bit more about Umbrella Multicultural Health Co-op, where it's located, the services and programs provided, and the communities and population that you serve. And I will point out, as I mentioned before we started, we were fortunate enough to have Umbrella as one of our support CACHC campaign videos. If anyone wants a lot more detail about the work, they can visit that video as well. But please, if you want to tell us a bit about the organization and the services and programs.
Yes, thank you. Umbrella Co-op is located in New Westminster, one of the districts of Metro Vancouver. It is a small district compared with the other ones, but it's in the middle of very populated around it. So we serve 4 ethnocultural communities. The one speaking Arabic, the one speaking Tigrinya, the Latin American speaking Spanish, and the Afghan community and others, Iranian, speaking Farsi and Darsi. Those are newcomers, new immigrants, and refugees. And we have many services. We have clinics on site and the mobile clinic serving Latin American farm workers in around to the south where the farms are located. And on site, we have clinics for all these 4 communities. We also have the social determinants of health program. We have community groups led by volunteers from the community, U Babies for Latin American moms with little children, pregnant and with little children, and U Seniors for ladies from speaking Farsi and Darsi. So we have those groups, and hopefully in the future we can organize more community groups, as they are very important for newcomers, no? To have those networks of support. Recently, a counselor joined us, so we are so happy that we have counseling services now too. Yeah.
Amazing, wonderful. That sounds fantastic.
Mm-hmm.
Over the last 3 years of the COVID-19 pandemic, it has presented unforeseen challenges in all of the sectors, and the vulnerable population has been one of the hardest hit groups. What has been the impact of the COVID-19 pandemic in your specific community, and how have you been able to address it? And how has your organization, Umbrella, been navigating providing care and services to your clients during the past 3 years?
Yeah, it has been very hard, as you can imagine. People new to the country, not knowing the language, so everything is more difficult. It was a tangible impact in all communities. We responded as quickly as we could, giving all the information in our languages. So through cross-cultural health brokers, we translated all the recommendations and public health orders to give them timely to all communities in all languages. And the cross-cultural health brokers were supporting community members. They were calling all the time with questions about not having work, the husband or the father in the family, or the mother, about children going or not going to school, putting or not putting masks, all the questions you can imagine pertaining the orders, the recommendations, and then when the vaccination started, also the vaccine. So I will say timely translation, daily support on call, organizing clinics, vaccination clinics for registered people and walking people, of course, and now with the health promotion program and the CVP project, we were able to do other educational activities and printing nice materials for people to better understand the pandemic and to better understand the need of vaccines.
Yes, what a perfect segue, because I was just about to say that Umbrella Multicultural Health Co-op was one of the recipients of the CVP-National PHAC funded project. Can you tell us a little bit about the project and its specific goal, and include any activities or programs that were carried out, like I think some of those translation materials that you discussed?
Yes, yes. The goals were introduce the project into the health promotion program, as we already have community health workers speaking each of the languages. So the first goal was listen from the communities, their concerns, their questions, their beliefs, their perceptions about the pandemic and the vaccine, their vaccine status. So first of all was listen, so we can plan what to do according to that. The second was building capacity among the community health workers. I mean, in order to talk about a health topic, they need to know something. So there were readings, explanations, and building capacity within them for them to get some knowledge and confidence to talk to community members about the pandemic and about the vaccines. With this, we organized educational activities that we call them workshops, two of them. The first one around vaccines in general. The name was Let's Talk About Vaccines. That was the first workshop. So we repeated it 4 times for the different languages involved, the different communities involved. And we did a second one specifically on COVID-19 vaccines and boosters. So we realized 8 workshops, 2 per community, trying to get to the point that people make sense of the pandemic, make sense of the orders, make sense of the recommendations, because they are in a new country, a new health system, having the language barrier, and having the social media impact, no, around COVID-19. So it was really strong. Some of their opinions on the pandemic and on the vaccines.
Absolutely.
So four workshops for vaccines and 4 workshops for COVID-19. And we developed the materials to run the workshops, and we printed them and we send them to community members, translated to 4 languages too.
That's incredible. And combating that misinformation was a very crucial part of, I think, a lot of the work that a lot of community health centers did, especially with the newcomer community, where they might not have known where the reliable sources were. And I think from what I understand, and I had the privilege at a conference recently to hear Umbrella Multicultural Health Co-op talk about cultural brokers. I think that they were so imperative in trying to combat all of that misinformation. And you might be speaking about that later on, and maybe I've teased a little bit about the cultural brokers. But we're curious, what milestones or achievements were able to be achieved and lessons learned during the project?
We were able to have 271 participants at the workshops. We were able to talk to more than 200 people, having conversations around vaccines and everything. When I was talking about listening to the community members, we used 2 tools: the client survey specific to the project, but also an uptake and intention survey on COVID-19. So we wanted to know the vaccine status and if they were willing to take the next vaccine or the next booster. So as part of that, we had a lot of conversations with community members in the hundreds. So it was very good, and in different ethnocultural communities. No? The community health workers are very excited with the readings, with the learnings, with their own confidence to outreach, to talk to people, to invite them to the educational activities. So we think we are building capacity there to further the public need of conversations on health. We have learned many things. We have learned that people, when they are given the space and the time to discuss their concerns, to learn about the mechanisms of disease, COVID-19, and vaccines, from that space of understanding, they make better decisions. They change their minds. But it's needed, that space, that time, that willingness of talking and listening to them, to have these conversations, and they get to a point that is crucial. During the workshop, it's really crucial to listen to one of the participants say, well, now I understand. Now I'm getting my booster. I didn't know before. So that has been really, really good, and it's good for our program of health promotion that we talk about many things with them. We organize workshops around the topics they are interested in. They are maybe having in the family or in themselves the need of talk about health. It is important to feel that need, no, to be aware that that need exists. I mean, they have family doctors. But we know the family doctor doesn't have the time to address the concerns they have around many things. So probably that's it. Or maybe the family doctor is just speaks English. So there is no real profound, deep dialogue on people's health concerns there, no?
Absolutely. I mean, and it's hard too when your doctor might not always represent you. So not only could there be a communication barrier, but if it's someone who doesn't necessarily look like you or fully understand what you're going through, it might be a lot more difficult to raise your concerns. And so that's also something we saw at a lot of community health centers. Have you or your team experienced any challenges or barriers to the vaccine promotion and uptake within your community, and how are those challenges managed?
Yes, I will say that we plan the workshops after work in the evenings. So one barrier is not there, the time barrier. On weekends too. So to facilitate access and on their languages. So that's the only way that they can come, if the activities are interpreted to their languages. We learn from the beginning, when we listen to their opinions and their beliefs and their perceptions, we knew that we have a real big challenge, because community members mistrust in many cases the vaccine, mistrust in many cases the health system. They were listening and watching to social media misinformation, as globally happened, right? As globally happened. It was very, very, so talking, there were long sessions, planned for 2 hours, but many of them more than 3 hours, because they needed to tell why they heard it is possible this to happen. I heard this, I heard that, my family heard this. I mean, you can imagine it was very hard. The pandemic has been very hard on all of us. So in these specific populations, even more because of the natural barriers they have as newcomers, right?
Yeah. Did your project specifically involve any partners or collaborations or any relationships that were able to be leveraged to ensure the delivery of the project?
Yes, we worked with Mosaic. With Mosaic, we organized an Arabic-speaking group of session. We provide interpretation for that, and we were looking at each one's materials and give some suggestions. So we worked together with Mosaic in some of them. Yes.
That's wonderful. And if you could tell us a little bit, sort of teased it earlier when I referenced cultural brokers, but if you could talk about your work with like peer ambassadors or community connectors, and what specific challenges or successes came with having peer ambassadors and community connectors within your project.
Yeah, within this project, we refer to them as community health workers, and of course they are key. They are key in the development of uh, health activities with community members. They are key because they belong to the community. They speak the language. They were inspired in how to outreach, how to connect, how to facilitate conversations. And they are interpreting during the workshops. They are interpreting and they are translating the materials developed for the workshops. So they are a key part of the correct development and delivery of activities.
Yes, I've heard quite a few projects, and I know that there was I believe a discussion as well at one of our communities of practice around the work of the community, the community health workers as well that you had, and I think that that's a wonderful aspect of the project. Unfortunately, of course, as you and I both know, there's been new variants, but with that did come the approval of booster doses. What effects have these had on the work that Umbrella Multicultural Health Co-op carries out, as well as the way the CVP-National project worked? And like, in other words, how are you able to adapt to the fact that this continues to be an ongoing public health issue?
Yes, it is an ongoing, but hopefully is soon ending, no? And it transformed to an endemic, to a yearly vaccination as flu. I mean, I will say that, but yeah, the point is be quick to read what is happening in the communities, be quick to read, be quick to address, translate, disseminate information in a timely way. For me, the response is that to read what's happening in the communities, to read what the health authorities and medicine bodies, international say, and rapidly give that information and that assurance and that hope to people suffering from their own question or suffering from the disease or suffering from not sure if getting the vaccines or not. So our work is exactly there to read, to know, and to give that knowledge and that reassurance and that guidance and that support to people. Yeah.
I'm curious, how has the funding through the CVP-National project helped your center and the community that it serves in a grander scheme?
It was really useful, really useful. It helped to develop the materials. It helped for part of the salaries of the community health workers, and we were able to equipment. We were able to have a very good equipment for many years to continue doing health promotion, a central part of a community health center. No?
Yes, it was an honor to be able to, help and participate in that way. I've been very touched to hear all of the work that's been able to be done with the CVP-National project. What are next steps, if any, for your center after the CVP-National project in regards to COVID-19 specifically, and your hope for the future?
Yeah, I was saying that I hope we are able to read, to address, and to resolve concerns, questions, and give them the last recommendations and public health orders on time in a friendly, gently, caring way to all individuals looking for our help. But it's been many months without a surprise on a new variant, and I will say that this is going to transform to endemic, as we're saying before, no?
Certainly hope so, sooner rather than later.
Yeah.
We tend to ask this question every single episode because it gets really great responses. But what do you think your experiences throughout the pandemic say about the ability of community health centers to adapt to emerging social and public health issues and the importance of community health centers within our health and social service systems?
Very, very interesting. That's the key of our mission, no? I mean, if we think in the burden of disease for the human species, we want to work at the beginning in the preventive part. And the community health centers should be really focused on that. Just the prevention. We don't want to have people with heart attacks and diabetes and cancer and everything. We need to work before. We need to work in the younger generations. We need to give much of our resources in that preventive part than in the solution part. So we need to work upstream, the burden of disease, the burden of complications, the burden of everything, because it's a more humanistic view of health. It's a more natural, it's a more logic way of working. In the community health centers, we have that mandate to facilitate a better, healthier life for our communities. And I think we need people with a clear view of public health, but able to inspire a team, very able to inspire a team, to really, when people understand, they make the right decisions. The thing that often happens is that people haven't had clear the purposes, because they don't have the knowledge. But if they have the knowledge and they have clear views of public health, and they have and they are able to inspire a team, I believe with community health centers, we are able to really promote healthier lives in our communities in doing that.
Absolutely. Knowledge is power. And I think that the work community health centers do to just demystify health and make it approachable and accessible is super important. I love to say that, I was not aware of community health centers before being in this job, and I'm always so inspired to hear of the work that community health centers get to do, especially as I start to learn more about what it's like to be in the newcomer community and in different other communities as well, and these different intersectionalities. And it's so important to just be able to access basic healthcare and have your rights and have your needs met. I want to thank you so much, Irene, for your time today.
Thank you.
If anyone listening was curious and wanted to learn more about Umbrella Multicultural Health Co-op, where would they go?
We have a website, and we can see past programs, present programs, which communities, how we do things, and it's www.umbrellacoop.ca.
Amazing. Perfect. Yes,
And
for Umbrella
you can connect
Multicultural
with
Health
us.
Co-op. Yeah.
Yes, Umbrella Multicultural Health Co-op.
Gotta make sure I get all of that in there. Wonderful. Thank you again so much for your time today, Irene.
Thank you. Thank you very much. Have a good day.
You too. Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centers. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.